Hello, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and our guest today is Dr. Anthony Al-Dehneh. You are an interventional cardiologist and a fellow of the Society of Cardiovascular Angiography and Interventions. You're also partnered with Okaloosa Heart Vascular Center. Is that correct?
That's correct.
All right, so tell me what you do. That's a lot of words, but just in a nutshell, what do you do?
We're cardiologists and interventional cardiologists. The basic work that we do, we take care of the coronary disease, heart disease, valvular heart disease. We do interventions. We come out to do heart attacks in the middle of the night when people are having an acute coronary syndrome. In the middle of the night, we come out in the middle of the night to open up those arteries and save lives. And that's basically what we do.
Is that all? I'm joking. All right, so tell me a little bit about you. Where did you go to medical school?
I went to medical school in New Jersey, University of Medicine Dentistry of New Jersey.
Okay.
And then I did my residency there, and I was a chief resident there. And I finished my interventional cardiology from University of Alabama, Birmingham.
Okay.
And I specialize in coronary disease, complex coronary disease, structural heart disease, peripheral vascular disease, valvular heart disease, structural heart disease.
So if somebody has a heart problem, they should come see you.
Yes.
Tell me where your offices are, because you have several, right?
We have several offices. We have an office in Destin. We have an office in Fort Walton Beach. We have an office in Twin City in Niceville. And we have an office in Crestview. And we have an office in Defuniak.
Wow, you are all over. You
Yes.
really are all over the area.
Yeah.
I'm going to ask you about a couple of specific procedures.
Yes.
But just in general, before we get there, just in general, when should somebody seek help? I mean, obviously, if they feel like they're having a heart attack, but is there any other maybe more subtle signs that people don't know about that they should run see you?
Yes, and you could divide the population into a male and female. Male patient present differently than female patient. Female patient do present really atypical, and their atypical presentation can be just fatigue. I don't feel myself. I was feeling fine, and I'm fatigued. Why am I fatigued? Subtle signs like that,
Okay.
and they should seek at least a primary care physician, and they get referred to us for further diagnosis and management. Male patients usually present more typical book-like presentation, crushing pain, chest pain,
Gotcha.
shortness of breath. I feel heaviness in my chest when I walk. And female patients do catch up to male patient when they become a little bit older and in their 60s.
Okay.
Usually they're protected to a certain degree by their hormone, but nonetheless, a lot of female patients in the past have not been taken seriously because people thought it's all atypical presentation, might not be coronary disease as a driving symptoms or the driving cause of symptoms in the female patient. And we have been paying a lot more attention to female patients at UAB especially. Sure. We did a lot of work with female patients, and we were able to identify disease early on in that segment of population.
Okay.
Yeah.
I would imagine that a lot of females would say, well, I'm tired all the time. I mean, that's when you
Yes,
said that,
yes.
like, well, I'm tired all the time.
Yes.
So what, is it a more extreme fatigue?
More extreme fatigue, yes, more
Okay.
extreme tiredness. They're not able to perform their activities as they used to be able to.
Okay,
Yeah.
all right, I get that. All right, now for some of the specific procedures that you're doing. PFO, tell me what that is, and ASD. I
Yes.
can't pronounce the word, so I'm just
Yes.
using
Yeah, patent foramen ovale and atrial septal defects. Atrial septal defect is a congenital cardiac disease. It's the second most common congenital disease in adulthood. And it causes a lot of hemodynamic compromise to the patient, meaning it causes chamber enlargement on the right side of the heart and increases the risk of having pulmonary hypertension, decreases survival of patient, increases arrhythmia. Some of these arrhythmia will lead to a stroke. And so discovery of such a condition at early age and management of such condition at early age is very helpful to some of those patients. And this is a unique intervention to this area. Never ever been done in this area before, and I'm the only guy that does them in this area.
And what is that intervention?
Intervention ASD closure. We close an ASD using a device called an Amplatzer septal occluder device manufactured by St. Jude Company, and it's a basically double disc device that prevent the flow from the right side of the heart to the left side of the heart and repair the circulation the way it was meant to be.
And is that a full open procedure, or?
No, it's a minimally invasive. We go through the femoral vein, through the groin. It's take almost like a heart catheterization. A few weeks later, we would not even know that you even had a procedure there.
Wow, that is amazing. Okay, and the PFO?
PFO is a patent foramen ovale. It's a structure that is important in when you're a fetus. It transmits oxygenated blood from the umbilical vein from the mother, from the right side to the left side. As an adult, it's the opposite. You go left-sided, it has oxygenated blood, right-sided has deoxygenated blood. So that structure usually closes, but in about 1/4 of the population, it never closes. That's 25% of the population. And it has no sequela at all, but some people do have sequela from it, leading to a stroke or right to left-sided emboli that causes a stroke in those patients. And that has to be done carefully. The patient has to go through a lengthy evaluation, including monitoring for arrhythmia, and it's a diagnosis of exclusion at that point if people have repeated stroke when they have this patent foramen ovale, despite medical treatment, then we close them at that point.
We're almost out of time, but give me one or two things that just the general population can do for heart health.
Exercise. If you could bottle exercise, would be the most expensive medication. Exercise is the most important thing. Obviously, reducing the stress in your life also is important. Stress is not a measurable endpoint, but everybody has some of it, but some people have more of it, and I think that's important. In general, if they could just exercise, eat healthy, a lot of salad, a lot of broiled fish in their diet, especially living in the Destin area.
We don't really have an excuse, do we?
No, so I think if they do a lot of that stuff, and we have much better weather than other areas in the country, so we could always exercise year-round. So I think it's an important thing.
Is it important any type of exercise, or does it have to be cardio?
Aerobic exercise. It depends about the age, about the intensity of the exercise. Older patient, walking exercise is very sufficient. Yeah, but a younger patient, they could do a little bit more intense cardio exercise to get their heart rate up above 120 beats per minute.
That's the key.
For a sustained period of time.
Okay.
Yes.
All right. Doctor, thank you for joining us, and I hope you come back sometime.
Thank you. Appreciate it.
All right. We'll be back.